Hi, my name's Jim Esch. I ran for Congress a couple of times here in Omaha's 2nd Congressional District. And, one of the big topics, even then and obviously today, was certainly the debate around health care and the need for reform in this country. To me, I don't know if there's a bigger issue because long term, it is going to determine the health and welfare of this country. And, at the heart of it for me really is the simple question of, do we believe quality, affordable health care is a right or a privilege? Because today in America, it's definitely a privilege. The people that have the money and have the power can afford to have good health care, and those that don't do not get that. And unfortunately, not even from a altruistic standpoint, I mean, even to say that, well, this certainly is a right and we should provide it, even if people want to look at it from a selfish point of view for them, the amount of money that each of us has to spend that does have health care on the people that have to go to the emergency room to get care, or the people that have no preventative care whatsoever that end up becoming extremely sick, and those, everyone else has to pay for it. I mean, it doesn't make any sense in this country today, with the wealth that we have and the abilities that we have, that we shouldn't have the best healthcare system in the world. And unfortunately, what's preventing that from happening is our own political system, in my opinion. And we can talk about all these solutions to healthcare, and they're out there. There's plenty of smart people. There's people all around the country that are doing, or all around the world that are doing it better than we do. But until we have the political will, or until we change how we elect people to office, and that we can combat the immense special interests that are on both sides of this issue that don't want to see anything but the status quo, I really don't know if anything's going to change. I certainly applaud President Obama for what he's trying to do, and I thought his speech recently in front of Congress was what needed to happen, that he needed to take the bull by the horns and say, we're going to do this and we're going to get it done. But unfortunately, and I saw it firsthand when I was running, there are just few people anymore that are willing to work across the aisle. And, it's interesting that this was Ted Kennedy's, last great hope of something great to accomplish in his lifetime. And, while the right certainly vilified Kennedy as a poster boy for the liberal elite, when you talk to anybody that was out there, be it if it's Orrin Hatch or a number of people on the other side of the aisle, had immense respect for Kennedy, his real ability, the thing that made him so successful and really so special to the country, was he knew how to get deals done. He knew how to work across the aisle. He knew when to compromise, when not to compromise. And in the end of the day, he was able to accomplish, arguably since Daniel Webster, maybe the greatest senator we ever had. And those people just really don't exist anymore in D.C. And it's because we've divided our politics so much, and we've, vilified the other side so much that, you don't get good leaders. You don't get people that can get something done. And so I guess if there's anything that I think is at the heart of this issue, is we need to educate people on the real facts. And news media outlets aren't going to do that. Our politicians probably aren't going to do that. And so, some of the new things that I want to work on is just trying to get that information out. Because I think if you get that information to people, and it doesn't have to be everyone that believes in it, but it's one of my favorite Margaret Mead quotes is that never doubt that a small group of people can change the world, because it's the only thing that ever has. And I think if we could get that sort of information out to people, to the folks that, ideologically maybe all over the board, but that kind of pragmatic middle base that I think exists in the United States, that's the group that's going to change this, because they're the ones that are going to say, you know what, I'm tired of the political BS, I'm tired of politics as usual. We need to get this done because it's important not only to me, but to my kids and my grandkids and future generations. And if that group can get engaged and start to affect the political process, then I think we have a hope at reforming not only healthcare, but energy policy and all the other great issues that are facing us today.